The other question that I get from the patients is how painful the breast augmentation or breast lift is. Obviously, again, it depends on the type of surgery that we did. Breast augmentation is much easier, less painful, faster recovery. Breast lift with or without augmentation has a longer recovery, longer swelling and longer recovery. But majority of time, rule of thumb is the first few days, patient has some pain that require pain medication. Sometimes they take narcotics, or they can take anti-inflammatory medication to subside the pain. Ice would help significantly. Also, wearing the breast binder is extremely helpful. But majority of patients, after a few days, they don't require pain medication. They still sore when they move, but it's not as bad, and it doesn't change their quality of life, and they don't require pain medication after a few days. And normally after 2 weeks, patients with the breast augmentation, they don't have that much discomfort. For the patients with the breast lift, it can it takes up to 6 weeks before they feel great and resuming the heavy exercise. Another question that I get is a breast implant or augmentation permanent? So yes or no. Obviously, with a new type of implants, with the cohesive silicone implants, majority of patients can have this type of implant for many years. Obviously, if they develop complications related to that implant, they may need a revision. But majority of times, we do not recommend to go and take them out and put a new one in unless there's an issue with the breast implants. Obviously, the company can guarantee the breast implants for maybe up to 10 years, but majority of times in the patient's population, sometimes people have these breast implants for a couple of decades before they need to be removed. The other question is there any higher risk of breast cancer after breast augmentation or breast lift? The actual breast cancer, like adenocarcinoma of the breast, is not shown that increase with the breast cancer, but we have a type of lymphoma called ALCL, which is anaplastic large cell lymphoma, which is associated with some of the implants, especially the rough implants that has been used, especially in Europe. In United States, majority of breast implants are smooth, and the ALCL has not been shown after this type of implants. But again, regardless, ALCL has been shown relationship with the breast implant. So extremely rare, but it's something that needs to be discussed with the patient, and also that's why these patients, they require to have a long-term follow-up and examinations with their physician. The other question that I usually get is possible to breastfeed after a breast augmentation procedure? Yes, you can get pregnant after this operation, or you can breastfeed normally. And the other question is, does it change the shape of the breast implant after the pregnancy? Of course, especially if you have significant weight changes during the pregnancy and after the pregnancy, then the shape of breast could be very different. You can have asymmetry, you can have significant sagging, especially if you had a significant weight gain, then that can affect your breast after you deliver the baby and you finish your breastfeeding, and you can have a saggy breast and required to have revision, lift with or without augmentation, or the breast implant needs to be changed with a different size. So I hope this video was helpful. If you like my video, please like the video, and also you can subscribe to my YouTube channel and look at a variety of videos that I have for different subjects and procedures that I do. And if you need further information about breast augmentation or breast lift, please contact my office for free consultations at 949-646-8444.